Every woman goes through a phase in her life when the hormones are declining. This is the perimenopause, and it ends at the time when the periods actually stop, which is the menopause. At this time, the estrogen hormone declines, and this process starts from the late 40s. Menopause eventually happens at around the age of 51. Of course, this is variable, and there are many women who suffer from premature menopause, which may occur even in the 20s, and there are women who continue to bleed till 54 or 55. So it is variable and often may be related to the time at which the mother had her menopause. The diagnosis of menopause is really by doing a hormone study and finding that the estrogen hormone has reduced and FSH/LH hormone has increased tremendously. A lot of women suffer from problems during menopause. One of the commonest symptoms that they face is that of hot flushes, feeling warm, sweating, redness of the face and neck even under a fan or in the AC. Other symptoms such as irritability, depression, mood changes, sleeplessness, forgetfulness, etc. are fairly common. A little later into menopause, women may experience vaginal dryness, change in sexual desire, as well as loss of urinary control, etc. There are major problems which the woman is not even aware of, and that is the problem of osteoporosis. Osteoporosis is weakening of the bones. The bones become very, very fragile, and over a period of time, a tiny trauma or just slipping in the bathroom or some such incidents may cause fractures, especially of the wrist, the spine, or the hip bone. These fractures can make the woman invalid and often cause her to be bedridden. The treatment really is multi-dimensional, starting from good exercise right through the 40s up until the 50s and beyond, weight-bearing exercise particularly, good intake of calcium which goes up to 1.5 grams per day after the menopause, and of course regular screenings for health issues and for cancers. Every woman 40 onwards must have a PAP smear, a sonography and a mammography every year to rule out any of the common gynec cancers. This, along with blood tests, will make sure that she is in good health. Then, in women who are symptomatic, for example with hot flushes, we can definitely give hormone replacement therapy. The hormone replacement therapy of today is very different from what it was a few years ago. The doses are much smaller, the drugs are a lot more natural, and of course the side effects are much lesser. Nowadays we give drugs like estradiol or DHILLON, etc., which are a lot more improved version of the earlier existing drugs. A lot of cases do not even need hormone replacement therapy. They can be treated very easily with alternative therapies. And now we have phytoestrogens, soya products, flaxseed products, etc., which really give good relief to the patient, and most of these are now available in capsular or powder form, and the patient can take them comfortably. Women who suffer from osteoporosis as diagnosed on a bone density test then have to be treated specifically, and now there is very good treatment for osteoporosis without the use of hormones. There are special drugs which can be given either daily, once a week, once a month, or even once a year, and they improve the bone density very, very significantly. So much so that her risk of osteoporosis may reduce over 1 or 2 years, and she may almost get a normal bone density in just a few years of treatment. So a very comprehensive approach is required for a lady in menopause: regular health checks, exercise, good diet rich in calcium, calcium supplements, alternative therapies, and in some patients specific hormone therapy or drugs for osteoporosis.